Doctors of Reddit, what's your thank god they came in for a second opinion moment? I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time. And of course, those are the patients that have a brain tumor show up on their CT scans. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility. Big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better, and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. I am a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. This is an important distinction because often if the doctor forwards your file to a different doctor, they'll flavor it with their interpretation. 19 meters at a time, 33 now. I felt sick for about a week, flu-like symptoms, didn't want to eat, just felt bad all over. One day at work I feel a very uncomfortable cramp tear in my abdomen, so I go to one of those 24 hours clinics. At this point I'm slumped over, can't stand up straight without insane amount of pain, just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones. Go home, drink fluids, sleep it off. This seemed fine to me. I was ready to go home and listen to the doc. All was good, but my girlfriend at the time didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER, against my wishes of course. After a few minutes at the ER, they determined my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6-7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. I was like 10 and my parents took me to the doctor cause I thought I broke my leg skateboarding. He said it was a 3rd degree sprain, told me I'd be fine. I pointed out lines in the X-ray and he said they were nothing. I somehow convinced my mom to take me somewhere else and they confirmed I had multiple hairline fractures in my growth plate. I am always impressed when dogs go skateboarding and are clever enough to understand X-rays. A bit of background. In my field of audiology we have people licensed to diagnose not only hearing issues but balance disorders and other factors impacting listening and understanding. We also have another field who popped up when it was not considered as ethical for us to treat those more serious hearing issues. That is, with hearing aids, but they don't need the same doctorate level training, just barely high school or some college depending on jurisdiction. So I had a patient come in with a serious difference between left and right hearing, and this in itself is considered a red flag because both ears are exposed to the same things over time, and there are very few explanations as to why one would get so bad. The patient could hardly understand words on that bad side and the better ear was pretty good overall, just minor hearing loss, perhaps age related. Immediately upon seeing these test results, the ENT and I agreed to send this patient for an MRI of the head because something was off. The patient confirmed no MRI or medical treatment had been recommended in the past and only hearing aids by this lesser trained hearing aid dealer, working for a popular US chain. The patient had been wearing these hearing aids already for a few years. The MRI results came back. Massive tumor on the hearing nerve. The hearing aid dealer is being investigated currently for malpractice, or more specifically a violation of state laws regarding red flags. I got a moderate traumatic brain injury in October, and the week after I got home from the hospital I wasn't acting like myself, was refusing to eat, and just didn't make much sense. My mom called the doctor a few times. They said it was normal but to take me in if anything changed. She took me in on the Saturday a week later because I started slurring my speech and was unsteady on my feet. The injury caused my sodium levels to drop from 140, normal, to 119. This in turn caused stroke-like symptoms, which were in reality a series of small seizures. Electrolyte imbalances are no freaking joke. Glad you're okay. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he'd done goofed and that I would be talking to our mutual chief of clinical services about the incident. Symptoms were all in his head. To be fair, it was all in his head, and possibly spine. Took me a few years to finally get my MRI and multiple sclerosis diagnosis. It is a B to get taken seriously for, so thank you for that. Wife went to a for pain in her pelvic region. Ultrasound showed a mass. Probably an ovarian cyst, they said. It will pop in time. Leave it alone. Went to the doctor about a week later. Had a surgery to pull it out maybe a month later. Did a biopsy on the mass. It was ovarian cancer. She is now cancer free, but WTF. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180, energetic and happy. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. People get headaches all the time, but if you go back 13 times with worsening symptoms, serious malpractice. She could have at least told you to go see another doctor if she wasn't sure what to do. I think a lot of doctors just don't want to admit they're not sure what to do and that a second opinion is needed. No one knows everything and it's fine to admit that. Not a doc, but a nurse. At a clinic a lady came in for breast pain with a lump. I was in the room for the exam for safety of everyone. The doctor told her it was a sprained muscle and to go away. When he left the room I told her the name of one of our other doctors that specializes in women's health. Told her she could not let this go. She saw him and he referred her for some radiology and that's how they found her breast cancer. She later told us all this in a sweet card she sent telling us if I hadn't told her to advocate for herself she may not have followed up. A bulk of my career lately seems to be maligned patients with legitimate medical issues who've been labeled as hypochondriacs and sent through for a psych workup and meds counseling. People with histories of all kinds of endocrine issues, like thyroid cancer, thyroidectomy, patients who see someone once every 2 years about their thyroid and never have labs checked or med dosages fixed, or diabetics with poorly controlled sugars, people who've had bowel surgeries and take time release meds, and then wonder why they aren't working. The piecemeal system of healthcare in the US is really doing such a disservice to actual humans. So many specialists and no one piecing together the big picture. Bit of a weird one, because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green, but very astute young doctor with a middle-aged female patient presenting with a vague 36-48 hours history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus tachy and raised CRP and WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and ARQ was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high, not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylate poisoning is insidious and has been referred to as a pseudosepsis in the medical literature as it often causes similar features. Comparing a high level in chronic poisoning to the same level in acute poisoning, features are much more severe in chronic poisoning, that is, pulmonary edema, hypoxia, ARQ etc. There is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the green doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away but it never did. She asked multiple doctors and did multiple x-rays but doctors said the replaced hip was fine. We finally made her go to her private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. A nurse here had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. This is some Grey's Anatomy crap. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did the usual full review of symptoms since he was new and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes but the other doctor told him it was normal. I think the other doctor should get his testicles checked too if he thinks lumps are normal. Eye doctor here. I had a patient I saw several months before they came in for their visit but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway just because we might as well while she was there. She was a 50-year woman. Fairly normal exam. Perfect vision. Retinas showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no, but suddenly reveals this crazy history of an old meningioma, a type of brain cancer she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important, but we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward. patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel, which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. You have been visited by the wealth rat. Subscribe in 12 seconds and he will share his wealth with you. I hope you enjoyed the video. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.